In its policy statement, as spelt out, the World Health Organization stated on World Polio Day 2025, we stand together to celebrate Africa's progress towards a continent free of polio and renew our collective commitment to protecting every child from this preventable disease. Now, this year's theme, End Polio, Every Child, Every Vaccine, Everywhere, is a call to ensure that no child in any setting is left unprotected. It then goes without saying that the global health body is treating polio specifically as an African problem and can be said to be sparing no effort in keeping the spotlight in that direction. But can the same be said about countries on the continent where issues around primary health care continue to be pushed to the back burner? Well, joining us now to look at the message of this year's World Polio Day is Dr. Lillian Ochayi, a resident doctor at Lagos University Teaching Hospital, Luth, and Public Relations Officer, Association of Public Health Physicians of Nigeria, Lagos branch. Good to have you on the morning show. Thank you for being here.
Good morning. Thank you so much.
Good morning. Yeah. Now, these are issues. That's how I'd like to just start by saying this. Polio, definitely an issue, definitely a problem within Africa, might be even said to be an African problem. But in the looking at it from the perspective of its preventability and how this can be avoided, how do you think we are positioning ourselves with a focus on Nigeria to make sure that we are polio free?
Right. So we are doing a lot, so far we've made a lot of progress. As a lot of people know, we were declared polio free in August 2020, and that was for the wild polio virus. So presently we still have the circulating vaccine dependent type 2 virus, which is still spreading, although we've had significant improvement over time, and we're still having those, but we need to put in more effort, and more of this effort, we're doing that through immunization, because we know that it is preventable, and that is one major way in which we can reduce the spread of this virus. So encouraging immunization and strengthening that. Also surveillance systems, that's another way we are ensuring that, once we pick these things early, once we notice a symptom that looks like it's reported and something is done about it, as fast as possible. So these are ways, that we have been doing, strengthening and trying to prevent more of this spread.
Well, thank you very much, Dr. Ochayi. I always love to be around a doctor because I know that just being a doctor, you must be very, very smart and clearly well-read and well-learned. So welcome, doctor.
Thank you.
I would love to use the opportunity of us having a doctor on set to really break down what polio is in the most purest form. Tell us what this virus is, what the most common symptoms of it, and how parents, because as you know, we have a growing population in this country, how parents can adequately protect themselves, educate themselves, and protect their children.
Good. Okay, so polio is a highly infectious disease, and it's a viral infection, right? So we know that it is transmissible through fecal oral routes, and by that we mean flies, an infected person using the toilet, not washing their hands properly, flies perch on that, move that. So you touch surfaces that have been contaminated, you can get it through that. Contaminated water and food, these are ways in which people can get infected. Another way is also transmitted through respiratory droplets, so coughing and stuff like that. People could also get this infection. So those are the ways in which they're spread. Symptoms, most of people that are infected do not show, symptoms, do not have these manifestations that we can see. But there's also a small fraction of people that do, have symptoms. And usually it starts with flu-like symptoms like fever, headache, sore throats, things like that. And then, in some cases it could go on to invade the nervous system, start to affect the brain, cause inflammation. Then you have symptoms like paresthesia. That's when there's like pins, needles, those sensations on the legs and hands. Then there could also be neck stiffness. There could also be, more severe complications like paralysis. There's irreversible paralysis. Then, this could also go on to cause the muscles for breathing. They can become also paralyzed, and then that could eventually lead to death. But that happens in like 5 to 10% of cases. So yeah, these are basically the main symptoms, and we know, according to the World Health Organization, that 1 in 200 of these infections lead to irreversible paralysis. But it is, still a small fraction compared to those that are infected.
I mean, it does sound very serious. I know we're going to bring in Adiso at this point, but I mean, this. Forgive me for what sounds like an ignorant question, because I'm very happy that you've laid out the symptoms and what the most serious cases could look like. Right. But Ochayi, I wonder if you've heard this. Viola Davis, she has a very distinctive walk. Sometimes people even make jest of it, but she's obviously an amazing actor. And I believe I read somewhere, and this is why I'm happy that we have a doctor here, who said that her distinctive walk is a result of a childhood case of polio. Is that possible, that someone having or suffering from polio in their childhood, it could affect the way their bones form or the way in which they stride, their stride pattern? Is that possible?
Yes, okay. It is possible, because, like we said, it could lead to paralysis, and in most cases it starts from the legs. So it depends on how the infection progressed, so that could also lead to, and there's even cases where people that had this infection as kids, later on, years later, they start to have some of these symptoms like weakness, things like that. So yes, it is possible.
Thank you, Doctor. I'll stop bothering you now.
Adiso, please, we'd love you to chime in at this point. Thank you very much there, Ochayi. Now, I want to ask, because it said, WHO said, I think in 2020, that we had eradicated wild polio virus. So is it that we're seeing a different version, or there's been a re-emergence? I just want to understand that, or there are different versions of polio, and is it difficult to get people to actually take these vaccines? And I just want you to take that also with another topic that is coming up, which is that malaria is resurging across Africa, but we also have a malaria vaccine. So when it comes to these preventable, diseases and preventable issues, is it that we're not doing enough? Is it that the structure isn't there, or is it that people are refusing to take vaccines?
Yeah, okay, thank you for that. So I believe the main thing with what you're saying is, yes, there's vaccine hesitancy, as we know, and this is due to a lot of rumors, there's misconceptions and things that people have heard, and there's also situations where some people have just had not good experiences, and they spread that, and people just get scared of the vaccines. But what we know is that vaccines are safe and they're very effective. Yes, a lot of people, we do have people that just decide they do not want to take, but at the end of the day, this puts the larger population at risk, because with what we know about polio and how highly infectious it is, one child that is infected can, cause a resurgence, and it could just keep spreading like that. And, it's what we should try to do more is, try to speak with these people, try to understand, where they're coming from, and explain to them, give them facts, right? Let's not spread fear and stuff like that. So it's just to say that this is good, not just for themselves, but also for their communities and the larger population. I mean, we're really on the threshold of eradicating polio, and we had that for smallpox. With vaccine, smallpox was eradicated, and this can also be possible. We just need to keep pushing and letting people know that this is a way they can protect their children, their loved ones, and the community.
Absolutely, we definitely need to keep on pushing. And I think we've spoken so much about this, but safety precautions, I think I would want to also bring that up.
Right.
As people, is there a way we can be safer? We can position ourselves to be, just much protective of ourselves to avoid, this, I believe it is contagious based off of what you are saying,
Yeah.
to avoid getting the disease.
Right. So that's a good question. So we already talked about one of the major prevention methods, which are vaccines, right? So ensuring that children are vaccinated, it's part of the national immunization schedule, and they're expected to have it at, different times. So ensuring that, every child is vaccinated at the right time, and even at, sometimes we have this outbreak response that goes on, and then we have, people go around to vaccinate. It's still good because it doesn't harm anyone, so we should still take it because it is safe. And another way to prevent this is, like when we're talking about how it's spread, I did mention that it can be transmitted through the fecal-oral route. So this means that washing your hands regularly, especially when you go to the toilet, and, wash your hands with soap and water. Make sure and even like with food you eat, don't just eat out, especially somewhere that you feel you question the source of the water, or things like that. So these are ways that you can prevent yourself from being infected, and just stay healthy. Yeah.
Absolutely. I mean, so it sounds like what you're saying, that hygiene is imperative here.
Yeah.
Personally, and just as a general for everyone should be washing their hands when they go to the toilet. Everyone should be conscious of where they are eating, the
Right.
water sources that they are exposed to. But I think for you as a physician, I mean, what would you like to see in terms of sensitization? How can the masses be sensitized? I'm asking because I wonder if you would agree that perhaps there are some pockets from the government, perhaps at the state level, perhaps at the federal level. Are there things that you think that they can be doing that would assist you and assist doctors like you in order to educate the public and give them not only, of course, access to vaccines, but access to education, so people understand, okay, having potable water is it shouldn't be a privilege, unfortunately, but in some communities, having access to potable water is a privilege. So, I mean, all of this, where we can say that people take individual responsibility to make sure that their personal hygiene keeps them safe, I can imagine that there are things that our leaders can do to help that effort. Is there anything that you think the government can do to further this cause?
Yes, I believe that we are already doing some of that, but we just need to strengthen, most of what we're doing now, with more connecting more with the communities, right? So we know that in communities, usually the community leaders, the religious leaders are usually people that people, look up to, and they listen to them, so this is one way we can keep, reinforcing this message, and, use them to pass this message. And also, like, just like you said, with health education and all, we can try to reach more people, even down to, speaking their language, using, terms that they would understand, and just to help them to understand better. And when they have questions, we should be ready to answer every question that they ask. So that would help to clear their doubts and help them to feel more at ease with these things. Yeah, so that, and then like I said, surveillance is very key, so also still strengthening that is very important. Yeah.
Adesoa? Oh, thank you very much. Now, I want us to focus on a little bit, well, I have a question for you rather, actually. There's been a lot of talk about the withdrawal of aid, whether it's USAID or withdrawal of funds from organizations like the UN or the WHO. Do you believe that, from your perspective, is that affecting the results that we're seeing on ground? Is that affecting healthcare delivery in Nigeria currently?
Yes, we know that that has affected, us here because we've been dependent on funding from those sources and all. But this is just telling us, and this is just helping us to know that we need to do more. We need to, on our own, be able to fund these things and, do better so that we can push this message and we can ensure that Nigeria is protected from polio and, so many other infectious diseases that, we still have here. So we just have to take it as a pointer that, okay, yes, we need to step in, we need to do better and, just try to curb this infectious spreading. Yeah.
Thank you. Thank you so much. Thank you so much for your insights on this very, very great topic. And we do appreciate you being here, Dr. Ochayi.
It's my pleasure.